Our moderator for today is Janet, and I'm going to turn the mic over to you.
Okay, but you have my list of people, so.
Yes, I do. Maybe I should give that back to you, love. There you go.
All right, well, I would like to welcome you all here today, and thank you for being here. At this point, I am going to ask Kathy Willis to introduce the secretary.
Okay. Did we get everybody else too already?
I'm sorry, what?
Did you introduce everybody on the panel?
I was told you were going to introduce the
Okay.
secretary, and then I would introduce the panel, so that's what we're
Oh,
doing.
my goodness.
Okay.
Oh, I'm special. Okay.
You are special. You are. Good afternoon, everyone. Welcome. And I'm Kathy Willis, Director of the Department of Community Services for Queen Anne's County. Very happy to see all of you here today. And it is my honor and privilege to introduce Secretary Carmel Roque from the Maryland Department of Aging. The Secretary is a very visionary leader dedicated to improving the lives of older adults and their families. She is known for her multi-sector collaborative approach to planning and preparing for healthier, longer lives in Maryland. She's an accomplished healthcare executive with more than 30 years of experience leading and transforming nonprofit organizations, building strong cultures of service excellence and innovation. Her experience includes dementia, palliative care, strategic planning, organizational development, community health and service delivery models for older people. And I can tell you, as a director of one of the area agencies on aging in the state, she has been a complete champion. And with her background in social work, it's a very refreshing addition to this program. For many, many years, we did not have this type of expertise at the state level, and it is a true honor for all of the AAAs across the state to work with Secretary Roque with such of her talents and abilities. We're very appreciative, and she is going to talk to you in a little bit about many of her initiatives across the state along with the governor's initiative to prepare the Marylanders for longer lives. And they have several initiatives that they're working on, and that's part of her strategic background, so right in your wheelhouse. We're very excited to partner with her and help do that in each of the counties across the state of Maryland. So join me in welcoming Secretary Roque.
We also have a very, very distinguished panel who will be answering your questions today. So starting all the way on your right is Dr. Joseph Ciatola, the Health Officer for Queen Anne's County Department of Health. We have Scott Haas, Director of the Queen Anne's County Department of Emergency Services. We have Gary Hoffman, the Queen Anne's County Office of Sheriff. Commissioner Jim Moran from the Queen Anne's County Commissioners. We have, sorry, I was looking at my notes going, that's not right. We have Kathy Willis, who is the Director of the Community Services. And Carmel Roque, who we've already heard from. And we also have Mike Clark, who is the Executive Director of the Housing and Family Services, who I can't see behind the slides. So that is our panel today. I have a list of questions I'll be reading, and each panelist, whoever answers it, will have 3 minutes to answer the question. At the 2-minute mark, you'll see people in the back waving at you, so keep an eye on those people back there because they'll let you know when you're getting close to your time. If there's time at the end, we will take questions from the audience. If you have questions during the prepared question part, I would ask that you save them until open question time. And with that, we're just going to get started. So. This is for community services. County Ride, can you tell us how it operates?
Sure. County Ride operates 2 different services. One is a fixed route service, which goes throughout the county on multiple different routes with multiple different vehicles and arrivals and departures that's scheduled on a regular basis. There is also the door-to-door service that we provide transport from your door to your appointment or whatever you're attending or going to And all of those services have been free for the past 2 years, so we're very excited to continue that.
Thank you. This is for the Health Department and Community Services. Can we have vein screenings done for free at the senior centers?
Well, the question would be, what vascular surgeon do we have available to come in and do a vein assessment of the population in the senior centers? That's not a service that we could easily provide through the health department, but I will do a little research and see what we have available as far as a nurse practitioner or even a physician assistant who might be able to donate some time or be available to come into our senior centers and do such an evaluation.
And it would also be well known to remind any senior center participants to suggest these things at site council also, or feel free to reach out to the senior center administrator, as we all work very closely with our local health department, and we'd be glad to work on any initiatives that you need if they're possible to attain in that setting. So.
Thank you. This is for housing. We need more low-income housing for seniors, those who make minimum wage, and for everyone else. This was specifically coming from the Sudlersville area, and it was mentioned in the submission.
Yes, it's the interesting part about that question is that there has been, especially over the last 5 to 10 years, there's been an increase in housing that's available and actually for low income. But at the same point, the population's gone up, so our percentage of available low-income housing is about the same, even though the amount of stock has increased. A few years ago, our housing office, which is the division of housing at the Department of Community Services, we've done a study, and they came up with some strategies, which include preserving some existing housing, which we're working on, adopting new planning and zoning policies, and incentivizing some new development for affordable housing, and through an MPD program, where when people do come in and build, they're required to build affordable housing at the same time, and explore partnerships in affordable housing. A couple of things we've done out on the island and out on this side are we've done some MPDU rental properties. So for example, we've got 20 affordable units at the Promenade that are there. They're required to be affordable. We're about to have about 6 units at the new Bay Manor Apartments, and again, that's in Stevensville. Some things that happen all over the county and have occurred a lot in the northern part of the county are some of our revolving loans. The housing office in the county offers revolving loans where folks can get up to $50,000 to put towards the price of a home to help cut down the price that they have to pay. And they pay no interest, and they do not have to pay the loan back until they sell or transfer the title on the home, and then it's good. So that's that's been something that's used all over the county, and especially in northern county. Most recently, we want to increase the existing stock we have. So at Foxtown Senior Apartments, through federal and grants and state grants, we've put a new roof and new carpets and made those places nice. And we also have a housing rehab that we use for seniors, a housing rehab program for seniors who own homes. And the idea is to help them be able to afford to stay in their homes with some of these grants. And we just recently found out starting to utilize some state funding for that. And we just found out yesterday there's another family that we just got approval from the state. We found that out just yesterday. And a lot of that happens in the northern part of the county also. But that said, there's always more we could do, and there's a lot of different organizations that contribute to that part of it.
Thank you. This question is for emergency services. What is the evacuation plan for the area during a major storm?
So this is an excellent question, and it's very difficult to answer in my 2-minute limit. So I'm going to kind of point the question back to the audience, because our plan is as good as what your plan is. And I can assure you that there's an extensive plan for Queen Anne's County, and there's an extensive evacuation plan for all of the Eastern Shore. The thing that you have to keep in mind with Queen Anne's County is it's not only our evacuation in a major storm, the whole Eastern Shore is going to be in an evacuation mode. And estimates are it's going to take about 72 hours to completely evacuate the county. The downside, if you look at a storm coming at us, particularly hurricanes, we are typically 5 to 6 days out, we start getting notifications that there's a storm and there's a threat coming. But the problem with that notification is we don't have a good grasp on the actual forecast for what this area is what is actually going to happen until about 24-hour point. And that's where the 72-hour evacuation doesn't match the 24-hour point. And I don't know if you remember Hurricane Sandy, but that was the last time that we actually had an evacuation order in Queen Anne's County. And that's a perfect storm to illustrate one coming directly at you, and then all of a sudden taking a turn the very last minute, and we called it an evacuation order, and then the storm barely touched us. So it's very difficult to predict and know when to evacuate. And the unfortunate thing is we have to supply the orders way in advance before we actually know the storm's going to hit. But the things that you can do is there is a thing called Know Your Zone in Maryland. And there's evacuation zones in Maryland, and there are several evacuation zones assigned to Queen Anne's County, and they're categorized as an A, B, or C. So if there's an evacuation order that goes out, you're going to be requested to evacuate zone A, as an example. You need to know if you live in that zone. The resources to find that out is if you get on the internet and just type in a search for Know Your Zone for Maryland, it'll pull up a state website where you can find out if you live in an evacuation zone, and it's also listed on the county website. And all you have to do is type in your address, and it'll tell you what zone you live in if you live in a zone. If you live on Kent Island or in the Graysonville area, I can almost guarantee you're in an A, B, or C zone for this area. The other thing that you can do to prepare for a storm is to go to ready.org, and that's a FEMA website. And there's an actual section on that website to tell you how to prepare to evacuate. And it gives you a before, during, and after on what you want to do in an evacuation scenario. And then probably the most important thing that my department offers is we do community emergency response team training. And I'm getting a wave that I'm almost done. But the CERT program, our community emergency response, is a program that we offer to the community, and you can request this class for your community. It's 40 hours total, and it kind of gives you all the emergency preparation that you need to do for any type of evacuation or for any type of emergency in your community.
Thank you. This is for community services. State retirees with Medicare benefits are losing their prescription insurance as of January 1st, 2025. Is it possible to have a meeting to help us understand the plans they have involving getting a plan for prescription coverage? What the state has sent out on information for us is very confusing.
Well, that's a very loaded question that could take days or months to answer. However, fortunately, our staff were very proactive in the Department of Aging. The program specialist, specifically Jennifer Hall, wave your hand, started sessions last week and this week, and I attended one of them the other day, where we're trying to help mitigate some of the confusion. And I will start by saying this is a state issue, and I'm sure the secretary knows very well about it, but we do the Medicare Part D enrollment every year. You know, that's coming up for your prescription plans. So that will stay normal for the folks that we assist. This is happening to Maryland state retirees and affecting their prescription plan. So the Department of Budget and Management has put out information, and anybody who's a recipient should have received information in the mail of what they need to do. So the sessions that we've had recently were just to explain to you the steps of how to do. We've already been to this center, Sothersville, and the Active Aging Center. We do have another session next Tuesday at Kent Island Senior Center, I believe Monday, the 23rd, sorry, Monday the 23rd. And then in your packets, if you got them, if you go to the Department of Budget and Management website, they will have virtual trainings, which you can watch on the computer, but they're also planning one for the Kent Island Library on October 18th. They have 2 sessions that same day. One's at 10 in the morning and one's at 1:30, but you have to pre-register and sign up. My concern there is it's probably going to be, I don't know, how much room, Janet, do you think is at the meeting room at the Kent Island Library? Or how many people do you think it would fit?
It's going to hold about 100 people. So.
Okay, well, that's good. That's very good, because we've averaged about 100 at each of our facilities so far at the events that we've had. So that's great. So if you have 100 twice that day, they'll be able to reach 200 people. That's fantastic. So, so that's what we have planned right now. And I got my wave.
Thank you. This just says others, so I guess whoever feels like they can answer it can go for it. Where is the money promised for the restoration of the old Centerville High School?
That money is $250,000. It was in a grant. It is for the repair of the roof and I believe upstairs window replacement or main window replacement in the historic portion of the building. I'd have to check with DPW when that project's going to start.
Thank you. Also for community services, please include lactated milk for lunches.
I would have to agree with that 100% because I use lactated milk. However, the senior centers follow RDA dietary guidance and allowances every day. So they are, all the menus are prepared by a dietitian, goes through our meal provider who we contract with. A lot of times, special accommodations like this, it depends on the contract. So anytime you have recommendations for that, you should inform your senior center manager or the senior center administrator. I'm not sure that the meal provider can do a specific change like that because we have a certain contract under the federal guidelines for meal services. So right now, that's not an option, and I don't know that it would be one. But we can check with the providers.
Thank you. The next one also says for community services, I want information about scams for seniors. I'm not sure if that's community services or Office of Sheriff, but off you go.
We could there's probably 3 of us here that could say something.
Yeah.
Do you want to start?
No, I'm
Okay.
good. I'm good.
We just, really, we refer folks to the Maryland Attorney General's website to look at. They have a Facebook page also, and they have a section for protecting seniors. Also available is the Consumer Guide to Protecting Marylanders from Fraud. There are so many things. We deal with individual, if you come to us and need help with something like that, but we don't know everything that's out there. But it should all be on the Attorney General's website. And you can get a copy by calling a phone number, but Secretary.
Yeah. So I just wanted to add that October is Cybersecurity Awareness Month, and recently the Cabinet went and visited University of Maryland cybersecurity, the classes and the programs that they have for producing people who are cybersecurity experts. And one of the things that the head of that program told me was that, we hear about scams, and what we hear is, it was $20,000, it was $10,000. But across the country, it's in the billions of dollars that older people are being scammed out of their resources. So we are going to work with our technology agency. Secretary Katie Savage is going to work with the Department on Aging, and we're going to do some special things in October just to try to raise awareness and to direct people toward resources. It's interesting that one of the main issues around cybersecurity and scams that affect older people is that we don't speak up. We are embarrassed, or we're afraid, or somebody advises us incorrectly not to bring this to the attention of law enforcement. This is illegal. Someone has broken the law if you are being scammed out of your resources. So don't be afraid to speak up. And please don't be embarrassed. It's not something that just happens to older people. It's a huge issue. So thank you.
I wanted to add, scams, there are kids out there being scammed on some of the games that they're on, and older adults are being scammed as well. But the one thing, and I agree with the Secretary, is is we don't want to be embarrassed to report these, and law enforcement is equipped to handle and take these complaints. But the number one thing that we hear is that it wasn't reported, or a family member said, well, next time just don't do that, or something like that, or sometimes we're just too ashamed that we gave out $2,000, $3,000, $4,000, $5,000. We can actually set up and do presentations for some of the senior centers, and we can also do those. I would love to do that. We have staff on hand that can also assist with that. So we'd be very willing to help with getting those presentations out there. The one rule of thumb I always want to tell you is, please, if somebody asks for a prepaid gift card, I can promise you it is a scam. And you'd be surprised. I saw a report from a couple weeks ago where somebody actually went to, I believe it was Food Lion, and got 4 $500 prepaid gift cards. If they're asking for that, I promise you it is a scam, whether it's law enforcement saying they're calling you, whether it's someone saying you have a warrant for past taxes, whether someone's saying that your grandchild has been hurt in an accident, or somebody saying that they need lawyer fees or something like that. Anything with a prepaid gift card is a scam. Call us right away.
Thank you. This is for safety in traffic. How many people have to get injured or killed before a traffic light is put up at the crosswalk and Kent Island High School?
Well, we're not sure if you're talking about the Cross Island Trail, because if you're talking about the Cross Island Trail, the light is up, it is functioning. Anybody on the trail, please push the button, the lights will come on to notify traffic. So if that's what you're talking about, that is completed and it's operational. It could not be on 24/7 like the other lights we have in some other locations, because it's proximity to the school, the high school, because they have lights for the high school also. So they didn't want to confuse travelers thinking that that was the high school light, when in fact it's not, it's a crosswalk light.
Thank you. This is for housing. Can we have a medical facility on site?
So when I heard that, I saw that, I thought that was an incredibly exciting idea. I'm not sure exactly who the person was that wrote that question, but because there's some of the residences we have do have and had built in some spots for this type of service, to have a medical facility, and there are actually some rooms that were meant potentially to be medical facilities at like specifically Terrapin Grove, and there might be a little bit of space at Foxtown. So, but just like with every great idea, you got to hash out the details. Just like Dr. Ciatola was talking about earlier with the vein doctor and the vein specialist, you've got lots of details you have to work out. What would the clinic be general? Would we have what group would we bring in to do it? Would there be enough money to cover and make it worth whatever group we had to come in to do it? Would we have enough people, or tenants, et cetera, with the right kinds of insurance that would be able to reimburse the vendor that provides it? So those are all things that I think we would have to work out and figure out. But in the meantime, I think it's a good idea and to look at and look forward for the future to consider. I would also, as we go out and meet with the different residence councils at the different developments, would like to talk more about it with you, and also when we meet with your executive committees, we'd like to hear more about what that would look like, and how you could see it working, and how many people you think would attend it and use such a service. But I definitely think it's something exciting to consider for the future.
And I think that from a health department standpoint, we're already starting to try and do some of these type of aspects with preventive care and wellness, and to start focusing on how we can address some of the issues before they become major health issues. And we're doing that strictly as on an outpatient basis. We are setting up times in our senior centers, also in the library. So keep an eye out for the news. We'll try and get more publication of what's happening where, and the screenings for both colon cancer, breast screenings, and we're starting to do more of that in the community. So understanding that it's easier if we come to you than you having to try and get a ride to an office or a doctor. So we've been working on that. We have an NP now in the health department who is going to do transition care, essentially meaning if someone is discharged from the hospital, before they get an opportunity to see their primary care, Because as you know, you call the office for primary care and say, I need an appointment, I've just come from the hospital. They want me to be evaluated and see what medication adjustments have to be done. And then they say, well, we'll see you in 3 months. Well, let me just tell you, 3 months isn't going to cut it for any of us. So what this NP will actually be able to do, transition care. She will be able to address the questions, talk to your primary care office, adjust the medications with the PharmD, and see, and that way we're at least providing the coverage, the initiatives that need to be done when you're discharged from the hospital and have no clue about what medications we still take, which ones we discard, and that way we can do that in conjunction with the nurse practitioner as well as the PharmD from the hospital.
Thank you. This is for community services, specifically the senior centers. Why have we not had any computer classes?
Well, in the past, we partnered with Chesapeake College to do the computer classes, and we have not been able to get any instructors from there. So in the spring, I believe, we partnered with the Extension Service and did what we introduced Tech Tuesdays with Maryland Extension, and they would meet with members to advise on their specific technology-related concerns. And you know, while we recognize the benefit of this, it's more about getting the instructors and the appropriate persons to come into the centers to do that. Again, an issue of vendors to provide it. We've also worked with the library too, and we hope to get more advanced abilities through utilizing their services that they do, because they have a very successful program for helping with computer skills and classes, and we hope to collaborate on that in the near future.
Thank you. This is for the health department. What are we doing to encourage more doctors locally?
Try to tell them not to retire. Because unfortunately, I'm the generation that is retiring, okay? And as you know, finding a primary care physician is like trying to find gold in the desert. To say that it's not been a concerted effort since I've been not only the health officer for the last 12 years here in the county, but also as your jurisdictional EMS medical director since 2005, and having spent 30 years in orthopedic surgery. Ladies and gentlemen, this is a crisis that people just don't want to talk about. There is such a paucity of primary care physicians starting new practices or even coming into existing practices. I've been pushing the board at UMS Corporate to try and start getting residents who are in primary care residencies, in family medicine, internal medicine, pediatrics. We need those residents here in the SURE system. SURE is part of university system. That's part of the medical school system. And the school system, the University of Maryland medical system, was the system designed to train and teach the future physicians of the state of Maryland. Well, I think we're not doing a very good job with that, because we're really not producing more available health care. This is a struggle for all of us. And I think that we need to stay consistently focused on making our community attractive to young families, working with our school system, with our business community, and I'm being waved at, so I'll wave back. And that's about all we can do right now.
Can I just add to that? So this is an issue that the health department and the Department on Aging and others have really been focusing on as part of the state plan. It's not unique to Maryland. It's across the country there is a real shortage of physicians, but we have particularly a shortage with primary care, pediatrics, dentistry, and of course geriatrics is almost non-existent. And a lot of it is in the way that we train. and the way that we recruit and retain physicians to stay in Maryland and to work in Maryland. So there are some very concerted efforts occurring at the state level to try to influence that. It's not going to get better real fast because it takes a while to train a physician. And because of the way our education system for physicians is set up, young doctors are incented to go into specialties where they can have much higher level compensation once they begin to practice. And so some of it's happening. The kinds of things that need to change are really major system kinds of changes. But I do think making your community attractive and having it be a place where a young doctor might want to come and start their family and grow here with the community is one of the ways to begin to make a difference. Thank you.
Thank you. This is for community services. We live in independent living. What happens when one no longer can adequately care for themselves? Are there any rules or steps taken, any other assistance as we get near this age in our lives?
Well, that's a multifaceted question, which depends on the situation. And yes, there are services available dependent on your specific situation. And if you're talking about maintaining in your own home, there are state and local programs that may be able to assist even through our department. Like we have some people who get home delivered meals or might have someone come in and do chore services. They are limited though. And when it comes to medical needs, if you needed nursing services or things like that, that would be sought out through your physician and paid for hopefully by your Medicare. Again, it's a very limited service. So when it comes to 24-hour care in your home, if that be the case, then you would be looking at private alternatives, private companies, and there's many around locally that provide that kind of service. They provide it for a fee, and those fees are not cheap. Honestly, institutional care is the cheaper alternative. But nobody's ever going to come to you and say, I want to leave my home and be in an institution. So we're going to continue, all of us as partners, to try everything we can to maintain you in your own home. Even if it's home modifications, things like that. There's a whole gamut, and we're going to work with each individual. So I always recommend you contact our department and come in and talk to one of the workers about your specific situation so we can cater a plan to that and hopefully get you some of the help you need to remain there as long as absolutely possible.
Thank you. This is for traffic safety. Why doesn't the county take over Route 18 Main Street so the county can close more exits to traffic? What is being done about weekend traffic on Route 18 east of Castle Marina and Graysonville?
All right. Yeah. So that is a very valid point, believe it or not. It is a valid point. The only way we get control is if we take over the maintenance and upkeep of those roads. What we've done just this past year, just ended 2 weeks ago, with the ramp closures is only phase one. The state won't let us roll out what we wanted to do, the beach to bridge. So this is another form of beach to bridge in pieces. So you know, we've gone through those ramp closures and we have seen the results, and we're going to be having another town hall. And I encourage everybody to come, especially from Graysonville, Chester, and Queenstown, because you're the one being affected the most on those weekends with Route 18 and not being able to move. So please come to these. But you know, one of the other options that I've discussed with the state is calling out a state of emergency and allowing us to take control of the Nesbitt exit and the Chester Haven Beach overpass. If we can control those two overpasses, that stops that traffic from jumping off and getting on the main street. So we have more coming in the future. It's just with the state, and unfortunately, you know, we have to prove what we're doing is working and then move on to more things, because the public is going to try and get around whatever we try and do, the beach-going traffic. So that's something that we're working on, and again, encourage you to come when we have the town hall, which is probably going to be sometime, you know, I don't know if we're going to do it before Christmas or after Christmas, but there is one coming, so we'll see.
Thank you. This is for community service. Why don't we have trips? Can we have senior center trips with enough advance notice that we can save and plan for it?
Sure, and I believe that the goal typically is to have 4 to 6 trips per year. That's for the department as a whole, not each senior center, but as a whole. And currently, we do have 2 trips scheduled. I can't list all the ones you had last year, but this year we have Harrington Casino and Raceway coming in November, and the American Music Theater's Christmas show with the Amish Holiday Lunch in December. For 2025, we again plan, their goal is to plan 4 to 6 trips, day trips, and they like suggestions from you. And I know I believe you submit them through your senior center site councils or to your senior center manager at any given time to be able to share for the planning purposes.
Thank you. This is for housing. Terrapin Grove is in need of carpets cleaned and replaced, new stoves as some burners don't work and the bottoms of some stoves don't close all the way, and the toilets are too small for seniors. We appreciate everything you do for us, couldn't ask for a better place, but these things need to be addressed.
Okay, it's a great question, and I'm going to start a little broadly first because I think one of the things that happens is a lot of those are being addressed and we can work on it. But I think the larger question or the larger point I would like to make is that, you know, over the past year and even before that, you've got a county and the county commissioners, Queen Anne's County, of which Commissioner Rand, the president here, has played a big part. And we also got the Housing Authority president here, Steve Wilson, who just walked in, and Kathy Willis, who is part of the Department of Community Services. They have put a lot of stake into making the Housing Authority and its residents stronger. And they've committed a lot to it. And because of that commitment, we're able to answer some questions like these. One, we've been able to increase our staff so that we can look at, and we were just doing this morning, I was meeting with our property manager, who we didn't have this time last year, a property manager, so we could look over and talk about different maintenance staff and housekeeping contractors to come out that we think we might have one that's going to do a better job for the folks at the different places, and we might even have gotten a little cheaper per week. We'll see. So that's the kind of thing that we can now, with the staff and the resources of the commissioners and everybody that's been working so hard to make happen, we can start to look at those things and try to make them work better. So we're able to answer this question. Hopefully I've got enough time to actually answer your question now. But we've got the resources to do that. First of all, I think we just recently got some carpets cleaned at the top of Terrapin Grove, 2nd and 3rd floor. The issue that I know, I looked at it and it's disgusting, that one carpet, but the reason is because that's the way, it's right on the way to the trash chute. So, you know, people are dragging and we're working to keep it clean, and that's one of the things we brought up with this new cleaning service. So hopefully we can keep that going. We've also done some things and we're looking to maybe get some grants to replace the carpets in the future. That's a goal. In the meantime, all of those things that you're suggesting, if your stove isn't working, if your toilet's too small, if something's not working, please, please, please call our office and get a work order. Don't tell it to a staff. You can still do that. And you can catch me after or something like that, and we'll work it. But get a work order. And if you're like, well, I've already done that and nobody did anything, well, it might have gotten lost. And please call us again, and we can get the work order going again. We've got a process now where we get the work orders, set up a whole process. We've set up a monitoring to get them done more quickly. And just go ahead and do that, please. So we can. All of those are fair questions. They shouldn't be a point. Your burners should work. Your bathroom should fit right, your toilet should be the right size, and we should be able to get that and make that happen for you. But you got to call us and get an official work order. Don't just tell your neighbor, don't just tell somebody, call us and let us get it into the system and get a work order on it and move on it.
Thank you. This is other. Can we receive a bill and receipt by mail, email, text, or any way? We sometimes forget.
And I'm not sure what that's in reference to, whether it's housing, is it for a bill and a receipt? I'm not sure what that exactly is. We wanted to encompass every question that was received early, so if anybody's here that could elaborate on that, that would be fantastic. Yes, ma'am. For rent, okay. Well, Michael, there you go.
Can we receive a bill or receipt by email? Couldn't it have been someone else? No. No, we can talk about that. That's another thing we've been working on. We've got a computer system and we're learning the ins, outs. We've had it, but there's certain parts of it, components that we can do where we might be able to start doing some more technical things like that. You are able to pay online. We are currently working on a new website to make it easier. For seeing a website is easier to navigate. We're in the midst of that right now. So those are some of the things. So we can definitely look at that and see if there's something we could do electronically to get it out.
Thank you.
Thanks. This is for safety and traffic. When traffic is backed up on the eastbound side, why is the westbound penalized in having to wait and be backed up? If people want to go to Ocean City for vacation, they should be the ones to wait, not the people who are coming from Graysonville or Centerville to do errands at Thompson Creek or in Stevensville.
All right, so let's see if I'm going to cut this one up. So what happens, if, we're going to start with contraflow. We're going to start at the bridge. Contraflow is when 3 lanes are going in one direction, eastbound, and where they have one eastbound lane on the westbound bridge, which gives us only 2 lanes going westbound. And this is every Saturday, and normally it switches over around 1 o'clock. And they're trying to keep steady with the time, but they'll extend it. Whichever side has the most amount of traffic gets that 3rd lane. So what we're trying to do is have them hold it and keep it until 1 o'clock. And then at 1 o'clock, they'll open up 3 lanes westbound. And what that gives us all, at least we know, until 1 or 2 o'clock in the afternoon, Route 18 is going to be a mess. Route 18 is going to be a mess because you have 3 lanes eastbound coming, and they're heading to the beach, taking up that 3rd lane on the westbound bridge. So westbound backs up. Now they jump off and get on 18, and they want to get ahead of the curb. So, you know, and it's frustrating, but if I could tell you one thing, I would tell you on Saturdays, don't go shopping at Safeway until 2 p.m. Go before 10 a.m. or honestly, go before 10 a.m. or after 2 p.m. And the traffic starts to diminish on 18 once that 3rd lane westbound gets open. It's a struggle, and this is one of the things we're talking about because of those ramps at Nesbitt and at Winchester Creek. The westbound traffic jumps off, and it's a parking lot on 18, and we know that, the state knows it, and we're in the process of getting a new bridge, but, you know, we're still 8 years away, you know, and this traffic's doing nothing but get worse every year, so that's where it sits.
Thank you.
Correct. Westbound.
Westbound is really.
Right.
Bad. I've seen 4 lanes on the Kitnara Bridge.
Yeah.
We got 3 going, and here comes emergency coming down the right side of me, right at the bridge. I mean, right at the wall, coming to try to get down to emergency somewhere further down, and we can't even see what's going on.
No, I totally understand, believe me. It's the fight that we've been fighting for 8 years, so.
We're going to move on to the next question, which is for the health department. What is the status of the new hospital?
Well, the hospital infrastructure has started the construction. When you go down 50 eastbound and you look right by the ice rink and the community center of Talbot County, that the hospital is going right next to that property. What they are doing is in the back, when I think it's 662, the road is in the back, it comes off of Airport Road. They have to move that road further west, and they have to bring in water and sewer. But those activities are starting. There has not yet been groundbreaking for the physical plant of the hospital itself, but that is planned, I think, at this point, spring of 2025. And I think that we're looking at least a 5-year window for construction of the hospital, depending upon weather, everything else. So that's the latest I can tell you. I mean, the governor did support moving forward with it. He's allocated money out of the general budget for the construction of the hospital. Size-wise, it will essentially be about the same size as the current hospital, but there will be better access for us, being on 50, and that the emergency room will have what they're going to call observation beds. So maybe we can see an improvement in time waiting to be seen and treated, and also time to be admitted, because these are all issues that we've been working with strongly with the University of Maryland Medical System board and administrative leadership. So that's
Thank
about
you.
what.
The next one is for emergency services. When Queen Anne's County Ambulance comes to Terrapin Grove, they must know to get the code to the box as they are coming in the door for code to door and master key.
So obviously, if somebody's asking that question, we've had a crew outside of your building locked out, would be my best guess. I can assure you, on the Department of Emergency Services side, all of our clinicians are trained on how to use what we call knock system, which is the locking system that's on your building. We basically have a keypad that's mounted in each one of our units, and all of our units on the fire and EMS side have these Knox boxes mounted in their units. There's a keypad on it. Dispatch issues us a code over the air to punch into the box. It's a one-time code. We punch in that code, it unlocks the key. We can get into the box that's mounted on the side of your building, and inside that box has a key to a master key to your building, and it allows us to get into the apartments in the building. The downside is most of the calls that we have to your facility, we're responding with 2 units. And if the first unit's in and it has a priority type call, both people on that unit are going to go in and evaluate the patient to find out what's going on. And sometimes that second unit will get locked out, or if they chock the door and somebody walks by and sees the door's chocked but don't know that there's an emergency going on, they'll unchock it and relock it, and the second crew coming in is locked out. Everybody in the system is very aware, and even the Sheriff's Department supervisors have knock systems in their vehicles in case of emergency also, but their field people do not have the system, and they have to rely on us to open the doors for them. But we are very aware and are very trained on how to use the system. And if anybody has a specific problem that they know about after this, grab me afterwards and inform me of what it is, and we can definitely get it cleared up.
Thank you. This is for community services. Please put a light in the Starlight closet. It is heavily used during the Starlight dance for getting extra supplies as we run out.
Fortunately, with new technology, we have all kinds of ways to request assistance get done, and now the Public Works has a facility request portal where we get to put in things we need, and your request has been put in. So the facility techs will go out and adjust and see how they can put a light in that closet. So that one was easy. Thank you.
This is for housing. We are concerned that we do not have a real security system in place. The one we have now is worthless for keeping strangers out.
So this is obviously a very important question, so I appreciate it. And I'd like to just start with one of the things I've noticed. I feel like since I've come on with the Housing Authority, there's been a lot of mysteries to solve and a lot of things to figure out. And one of the things I've learned is how much during the past time that the Sheriff's Office did to work to maintain safety for the Housing Authority and continue to do it. I was talking to the Sheriff, and the amount of stuff he knew about the Housing Authority, what he has been doing to help the Housing Authority, a lot of it, which goes unknown with folks. You don't realize how much they're paying attention, how much they're working and thinking about it. So I appreciate that very much from the Sheriff's Office and the Sheriff specifically. Thank you. And specifically, some of the things we've done, again, we have more staff, but we're working very hard to bring all of our security cameras back up to speed. So we have that. They're going to be regularly monitored by staff, and we have staff appointed to monitoring them. With the new staff, I've tried to put them out so we have more staff on site more often, just that way. We've been collaborating with the Department of Public Works and Queen Anne's County IT Department to get some of the pin pads and the card readers. we're working on it. It's still not 100% done, but those pin pads and the card readers working more clearly. So those are a couple of things. We continue to collaborate with the sheriff, which I appreciate immensely. And another thing that we're working on is specifically with our increased resources, we're able to look at leases. And if people are violating their leases, especially in regards to safety and security, we can enforce those leases and sometimes evict or have people or not renew a lease because of a safety issue or a crime issue that's been committed. And we can help folks feel safe from there. Other than that, we can also hear concerns or ideas from the various tenant councils and just folks that catch us. So yeah, it's definitely something that we take very seriously. I don't know if
Thank you. This is for community services. We would like better lunches. Food selections are limited. Food is processed. Food tastes awful. Can't eat the food because of the salt content. Meat doesn't look good, and we need a new food service vendor.
Wow, I'm sad to hear that. Again, we have federal guidelines we follow for the content of our meal delivery. They're provided by a vendor who provides for many senior centers across the state. There is no food vendor in Queen Anne's County, so our food vendor comes from Arbutus, I believe, and they serve they serve Frederick County, others, various, and they've been serving us for a long time. And I have heard a lot better comments more recently about it. I thought the Active Aging Center was pretty happy, and they're receiving the same meals. The difficulty is when federal guidelines tell you you have to serve with certain requirements and so many legumes a week and things like that. That's in order to get our funding for it. If we didn't have those guidelines, we wouldn't have the funding for it. And just this past month, we went out to bid earlier and looking for food service providers, and we only got 2 back in. We maintained the contract. We awarded it again to our current provider, because when you get other providers who have never done this before, and their prices were a lot higher than this one, you know, we have a budget to maintain, but on the alternative, we also meet with our food service contractor on a regular basis. Both the home delivered meals and the congregate meals, the administrators meet with the group, and they give them, you know, complaints and suggestions and try to work out things to make them better. So I'm hoping we can forge a better relationship, and please continue to tell your senior center manager specific issues you have with specific meals, and that we can work with facts, you know, and we really need the details. So thank you.
Thank you. This is for other. We need affordable internet for seniors.
That's a toss-up. Who wants to talk about internet?
I have just limited information about this, but I do know that the state has a plan and funding to try and make sure that internet is extended into all areas of Maryland. And it isn't just like, well, okay, now it's available. There's a whole infrastructure that has to be put in place to ensure that there's broadband available and Wi-Fi. So that's one issue, which is the infrastructure available across the full state? The other is affordability, and that's something that actually government can't dictate. So the issue would then be, is there a way to subsidize people's internet bills? And I have not seen anyone suggest that that's something county or state government should take on at this point. Older people, contrary to sort of the myths about this, 90% of older people use the internet, use their cell phones to obtain basic services, to stay in contact with their loved ones. This is not, you know, it's sometimes presented that like older people don't use the internet. Yes, they do at very, very high levels, which is why it's so important that it be available and that there not be parts of the state where there just isn't any infrastructure in place to make sure that that basic service is available to people.
All right, thank you. This is for community services. Use videos or YouTube with TV to give yoga classes. Only 2 one-hour sessions all week at Kent Island. With videos, we could have yoga every day.
Well, that's a good question. It's a good program to do, and I would think the senior center manager at that facility could tell you, and working in their schedules is to, the space available for it. I know we have wonderful systems now of rolling TVs with internet service to them where we can move it, and we actually utilized that at the Active Aging Center this week for the benefits counseling sessions we had. So really, that's something that each individual senior center, based on preference, availability in their schedule, and availability in the actual building, like where your logistics of, what room do you need? Does it need to be quiet? Do you have to have, mats for those type of things? It's absolutely something that I think your senior center manager would entertain if you just suggest it to each individual one, because each senior center has different needs and requests.
Thank you. This is for housing. There is a lack of interest at Tillman Terrace. It should be low fee or free. Can the building have coverage like other businesses? I'm thinking they might have meant internet, but it says interest online.
Oh, okay. Tillman Terrace, interestingly, is not owned by the Housing Authority or Queen Anne's County. It's actually owned by an organization called the Centerville Elderly Housing, which is managed by Upper Shore Aging. And I contacted them, and they said they're not, like when I asked them the question, they said they don't charge for activities held on their property. But if you have any questions, you can call Gary Gunther or Amanda Kerr, who is the property manager out there, and they can be reached at 410-778-6000. But in regards to that, I think that point that they're not owned by the Housing Authority or the county, it brings up a bigger point that oftentimes, and for folks that are looking for senior housing, for folks that are looking for affordable housing and affordable rental properties or rentals, oftentimes they'll make the mistake and think that the Housing Authority is where you go for all of that. And in fact, it's not. There's a lot of places outside that provide, there's a lot of organizations that provide affordable senior housing within the county that aren't the Housing Authority. And I would encourage that when folks are looking to look at those areas also, because as you all know, or most folks know, we have a pretty long waiting list at the Housing Authority, and it takes a long time to get down that waiting list. So in the meantime, you should be looking at every option possible. So there's a resource table, and I brought a list of all the different properties that are available and all the different residences and all the different organizations that provide senior housing and affordable housing. And it's right there. We've got, it's a list. You can just grab it off the resource table. And I would encourage not only getting on our waiting list, but also making phone calls out to those other places just to see if they have anything that might fit. And you might be able to get into a place sooner. So I just thought that would be a good place to add that with that question.
Thank you. This is for community services. Please continue Cheryl Bush's classes on healthy meals.
Well, that's a great comment. We appreciate Cheryl's participation in all the senior centers, and I know there are plans to continue that, her Healthy Meals programs, and so that's not really a question for us. We want to continue to do that in all the centers, but thank you.
This is for safety crimes. All the crime coming to my quiet county area that used to be calm and you could hear the nature sounds, but you can't now.
I'm not really sure what area they're referring to. So if somebody asked that question, I would be glad to elaborate a little further on that. I do want to say that Queen Anne's County is one of the lowest in the state for crime. And I have to thank our community for that, because there's not a day that doesn't go by that our community doesn't report something to our office that they see as suspicious. So there's only a handful of deputies out there, but in this room there are more people working for us, keeping our community safe than police officers on the street. So I thank all of you that have given us tips and information to keep us all safe. If we didn't have the outlets, they'll probably hate me for saying this, but if we didn't have the outlets, we'd have no crime at all. The outlets is my biggest theft hub in the county. We had the other day like 2 back-to-back thefts in a row. It just seems like it's a place where people from other jurisdictions come. They steal, they run in, they think that this is Prince George's County or some other place that they could do this. They come in and do it, and then they run out. Well, we have a zero tolerance for crime here, and our staff locks those people up. We're not going to tolerate it, and that's going to continue to keep us all safe. One thing I would suggest is that we have a phone app available, and our staff will be here today to give you these. If you want to download our app, there's a real easy way on your smartphone, if you have one, to report suspicious activity to us or information that you want to report to us that would be beneficial for us to have. Reminder again, if somebody calls you, it's a scam. If they ask for a prepaid gift card, I can promise you that. So thank you all.
Thank you. This is for community services. Is there any way that we can get Ozempic to be affordable?
Well, Medicare recipients who are trying to get the Ozempic should see a decrease in the overall cost in 2025, because the out-of-pocket cost for Medicare Part D, or for Part D, the prescription plan will be decreasing because of the out-of-pocket limitation. There's also an option for payment plans for drugs through Medicare Part D for 2025. And we have, as Mike mentioned, we have the table out here with the information, or the program specialist at the Department of Aging can help you work through that if that's something you need.
Thank you. And this is for emergency services traffic. With traffic concerns, what is the county doing to assure residents that ambulance, fire, and other services are available to reach them during high volume times on Friday, Saturday, and Sunday? How will these services get to the residents timely?
So the only thing I disagree with this question is it's not just Friday, Saturday, and Sunday. Our traffic problem is basically 7 days a week. In dissecting this issue with the traffic, my best partner is sitting on my right, actually my best two partners, but I can assure you the county commissioners are addressing this on a daily basis. And if I ever go to war, I want Commissioner Moran in my trench with me, because he has fought this battle over and over again on a local, state, and every level that you can think of. But one of the main things that he did that helped us this year, and I can't think of a weekend that we really had a scenario that we couldn't break through the traffic, was the lane closure that the commissioners did or were able to achieve through the state. With those lane closures, it really freed up 18 and allowed us to really cut through a lot of the traffic and get to emergencies when it was necessary. My second best partner is the sheriff sitting next to me. They have allowed us to do a lot of things that we're really not supposed to be doing. But it's not so much of a concern getting to the emergency, it's more of a concern for us getting back from an emergency. And that's where our law enforcement partners have helped us a lot. So if you see a unit running down the shoulder of the road and there's no lights or sirens on, they're probably returning the service. And that's critical for us. And that's the hardest part of our service delivery, is getting home, not getting to the hospital. In our worst case scenarios, we have one state resource that can help us a lot. And if we can't get you to the hospital, we also have access to the Maryland State Police Aviation Division, and we can actually fly you to the hospital if it's a true emergency. Doesn't happen frequently, but it does happen. And the biggest thing that the residents need to be aware of is we can't always deliver you to the emergency center that you want to go to, because we don't have a magic wand and we can't part the bridge and actually get across the bridge sometimes. So sometimes we have to go to different facilities, and it's best not to try to venture out on your own to figure out which one is the best facility for yourself. It's best to call 911 and let us help you make that decision, because we're in constant contact with State Highway. We monitor all the roadways through cameras, and we basically know the best routes to take to get to the right facilities. And we do actually have an operational plan. It's called Operation Bay Bridge. And every time traffic backs up on either side, we go into Operation Bay Bridge mode, which notifies our law enforcement partners that we are going to be using the shoulders when we normally don't. And it also enables us to move units around, to place them or pre-place them on the other side of traffic so we can respond quicker to the emergency. But on a daily basis, between law enforcement, us, and the commissioners, this is a fight that we continue to fight, and we are making breaking ways of getting through the traffic, but there isn't a lot of good solutions to fix all of it at this point.
And you also got to remember the ramp closures. The reason they were manned by so many individuals is so when Scott's teams came up there, ambulance, whatever the case may be, they'll move out of the way and allow them access to get through. And also, it's not only his department, but all of our volunteers. They have to be able to get to the equipment in order to get it out of the house and get to the incident. So it is critical that we're able to move around. And the Operation Bay Bridge, isn't that where we close all the ramps and flush it, or is that something different?
So the Operation Bay Bridge is mainly just for emergency service personnel. And basically what it does is we go on to an alert, it's called Blue Alert, and that notifies the hospitals that we're in a semi-crisis mode and they have to accept our patient, even if they don't want to, they have to, depending upon what their level is. And it also gives like our freestanding ER notification that they might be receiving a patient that is not the normal level of patient that they normally see. But the interesting thing, when we did the ramp closures, I know the commissioners met a lot of resistance from the community when they started proposing the ramp closures. And the interesting thing was there was one weekend that we had a storm roll through and they were unable to do the ramp closures. And the number one call that we got in the 911 center is, why aren't the ramp closures in place? So it tells me it's definitely working on all levels. And the last thing that I would do for this group is, you are capable of touring a 911 center, and I encourage you to take advantage of that and actually come up and see how we take a 911 call, how it's processed, and actually see the equipment and how we monitor the traffic and see what actually our dispatch center is providing to the people out in the field. But we're open 24/7, and you're more than welcome to have a tour anytime with us.
So Kathy, if I may, for the center managers, there's 2 more tours or 2 more trips because DES has their, and we can come by the
Great.
sheriff's office. So
Thank you.
yeah, there's 2 more. We'll even serve lunch that day.
It's on the sheriff.
Careful.
Better have lactate.
Well, thank you. At this time, we are going to invite Secretary Rokes to get up and say a few words, and I apologize for skipping over you at the beginning of the agenda.
Oh, I have to say, I am so happy that I got to hear this robust conversation. And I've been taking notes and chatting with my partner in crime over here, and I know that she said, don't mention me, but I want to call out Leslie Ray, who works with the Department on Aging. And I always say she's my secret weapon across the bay. That's right. This is her home. And she, one of the things I wanted to just build on about emergency response is, you know, the best thing you can do is don't have an emergency. And one of the things that is such a huge issue for our older population is falls. And it is one of the main reasons that older adults end up in the emergency room. And it is one of the main reasons older adults end up not being able to return to their homes. So when you are, I mentioned this as an older person who's now had 2 falls, and the reason I had those falls were my hands were full and I was rushing. And in one of them I fell right on my face. And that's a very frightening and scary experience, but I could have had my hands free. I could have not been rushing. And so it's really simple things that can make a huge difference. I wish you all to never have to call 911. So I do have some prepared remarks, and I'm going to stick to them a little bit because, as my staff knows, otherwise I go wandering off on a tangent, and we'll all be here way longer than you want to be. So first of all, I just want to thank you for inviting me. And I loved being here last year, and I am happy to be here again this year and to see some of the same wonderful people who presented, and also to hear that your concerns about your housing have been somewhat resolved, and it sounds like there's wonderful leadership working on that. As the secretary for the Department on Aging, you know, I had not done public service before. My long career has been in healthcare on the private sector side. And so coming into government was a new experience for me. And when the governor asked me if I would take the role as Secretary on Aging, we had a frank conversation about his commitment to older adults, the 1.7 million people in Maryland who are over the age of 60. And was I going to be able to be active in advocating and representing that population? And the governor and I talked about the fact that he highly values older people, partly from his own experience with his grandma, and also because he knows what older people contribute in this state to the well-being of all of our citizens. And one of the things that I wanted to just raise to you, because, you know, often what we hear is, oh, older people are a burden. Did you know that in the latest AARP report on Maryland, one of the things that they lifted up was that there are 760 family caregivers in Maryland, unpaid family caregivers in Maryland, which that actually provides about $12.5 billion of unpaid care. So don't let anybody ever say that you don't contribute or that you're a burden because you're an older person. That's just one example. And by the way, 60% of those caregivers also work full or part-time in addition to their role as a caregiver. So they're paying taxes and they're contributing to the economy. So one of the first things the governor did was to sign an executive order saying Maryland needed to have a multi-sector plan to prepare for older lives in the future, but also to think about older people who are living in Maryland right now. And that was a job that he gave the Department on Aging. And so we know that in a very, very short period of time, 1 in 5 Marylanders, 1 in 5 will be over the age of 60. And in 10 years, there will be more people over the age of 60 than under the age of 18 living in Maryland. So older people in Maryland are a big deal. And we need to be thinking about how to be sure that older people can live lives that are healthy, financially secure, socially connected, and have purpose. And that is the reason we're doing this multi-sector planning process. So, what are some of the things that this multi-sector plan is going to pay attention to? It's some of the very things I heard you lift up in this conversation today. People want to be able to live in their community and in the home of their choice. That means it needs to be affordable. And Maryland, like a lot of the country, has a big deficit in the amount of affordable housing that is available. And so you on the shore, you're experiencing that, as is the whole state and as is the whole country. And I'm really happy to hear that there are some things happening to try to grow affordable housing. We want to be able, as older people, to find a health care provider, get to the health care provider, and once we get there, to be able to afford our health care and afford our medication. And to the thing that was raised earlier for the retirees who are having their drug plan shifted around, you can still feel free to talk to your regular Medicare enrollment specialist at the senior center or at the Department on Aging, and they can help direct you to what it is you need to do. So don't just throw your hands up and panic. And we also want to find ways that, older people can live vibrant, engaged lives and aren't somehow marginalized or segregated from the rest of what goes on in your community. So our plan that we're working on right now is going to guide us in those efforts. And we know that a major part of getting this right is hearing from all of you. And so there are town halls that are going to occur. There is various task forces have been formed that are focusing on specific issues. And what they're going to do is lift up the recommendations for the things that we need to do to make sure that Maryland is one of the states in the nation that is well prepared for our growing older population. We don't want to just pretend like that's not happening. We want to be sure that older people can actively participate and live vibrant lives for the full life course. So it isn't just, longer lives have happened. That's a reality across the world. It's one of the greatest accomplishments of humanity. Human beings now live longer than they have ever lived before. Not everybody gets to live longer, so there's a whole issue around how to ensure everybody receives that benefit in their life. And most importantly, it isn't just living longer, it's being healthy for those extra years. And so that's a big emphasis for the multi-sector plan. So I was thrilled to be here with all of you. We're working on Longevity Ready Maryland. You're contributing to that process just by being here today and participating actively. And I want to thank you for that. I want to thank you for bringing your wisdom and your knowledge to the planning process. And we'll be back once this plan is in a draft form for public hearings and to engage with you again. So thank you so much for a great day, just a great time with you.
Thank you. Now, there were a few more questions that came in that I'm going to ask the panel. Lucky you. And then we have someone who has actually signed up to ask a question. So one of the first questions is it possible to get a trip out of state or abroad? I guess that's community services.
Oh, out of state or abroad. I'm assuming you're talking about an overnight trip, obviously, probably. We do not do those type of trips any longer. They used to be done many, many years ago. They cannot be done really through with the government employees and such, and having to have chaperones and things like that. We looked for most AAAs or most other area agencies and senior centers across the state have what they call like Friends of the Senior Center, and they develop a 501c3 nonprofit program that runs trips and things like that. So that would be an option if the individual senior centers wanted to do that, or if the county as a whole, somebody wanted to develop that 501c3. But with the restrictions on our employees, it's something that we cannot invest and have staff who are leaving and going on trips and managing them and planning them, the hours, the countless hours and things that go through that are not a part of their regular duties, which make it very difficult when you have one senior center manager per senior center. So now we will not be planning them through the department. Anyone is free to reach out to anyone who is interested in doing a more of a nonprofit effort in that instance. Thank you.
Thank you. I'm not really, I think this might be housing. This person is opposed to a hot water tray underneath it. Can you have an alarm detector meter installed on the tray? I'm not sure what that refers to, but I'm thinking it might be a hot water hearing.
I mean, what it boils down to is whatever the issue is, just give us a call and we've got a facilities manager now and he can come out and take a look and we can see what we can do. If that's not a possibility, we can still look and see what the problem is and find out if there's another way to solve it. So first step is give a call and we'll take care of it. We'll look at it and see what we can do to take care of it.
Thank you. This person is asking why the state is allowing drivers auxiliary noisemakers, like on motorcycles and trucks, loud mufflers. Why is that allowed?
So, my turn to be up here. So, it is illegal for someone to modify their exhaust on their vehicle. Very often, we write the equipment repair orders for that. But what we find is that once the person gets them fixed, they go ahead and reinstall that back on their vehicle. So we have this progressive issue of chasing these guys and girls down that modify their exhaust systems. It's a very common practice, and it is as bothersome to us as it is to you. Certain jurisdictions have ordinances that prevent jake brakes from being used. I know the town of Sudlersville does have an ordinance on the books, but jake brakes are basically a mechanism that a truck uses to slow itself down instead of using its actual braking system. Saves on the brakes. It's a combustion theory, I believe, with the engine, if I'm correct. So. Yeah. Is a certain area that you're seeing a lot of that at, if you don't mind me asking you? Okay.
Between the bridge and the outlet, all of it.
Okay.
All right, our next question is about, are there any restrictions on seniors 70 or older driving anytime in the day? Or anytime?
No restrictions at all. I applaud all of our seniors who drive and are able to do so safely. I recently had a grandfather who just passed away who was driving at 100 years old. So I applaud all of you who are able to still drive and encourage you to do that and be healthy and be safe.
Janet, the young lady over here had a question or a follow-up to the first question that was asked, but we didn't see her hand up.
Oh, go right ahead.
I probably don't need this, I'm an old school teacher, I talk loud. I asked that question, I live in Centerville, I live on Liberty Street, 213 South. It used to be a quiet street. But I also listen to public radio, and I hear that some communities, some states are outlawing them, in which case they could at least get a citation.
Yes, ma'am, that's true. So that would be a question that really needs to be, and I'm not punting that, I just don't have an honest answer for you, but that would be a question that really needs to be directed to the town council of Centerville and the police department.
The town council to, we've tried to put on parking restrictions, and the state made them take it down. We used to have signs about modified mufflers. They disappeared. I assume the state made them take that down.
Yeah, I wish I can. I'm going to make a note of that and try to I'll give you my number afterwards and maybe do a follow-up with you.
Okay.
I don't have the answer. I'd have to reach out to Centerville, though.
Because even without that, it's quite a street, besides the big trucks, which you can't do anything about. But the motorcycles. One Sunday afternoon, a pack went by, 50 motorcycles, and I stopped counting. That's not a pleasant way to live, I can
No, I
tell
understand.
you.
I believe.
Thank you very much.
And our last question that was submitted was, who funds the county ride, and are they going to keep it being free?
The county ride program is funded through multiple sources. We have funding from the state of Maryland, from the Maryland Transportation Authority, which also comes from the Federal Transportation Authority, and we have a good portion of our funding, a larger portion of the funding that comes from our county commissioners. So our programs are very well funded at this time. One of the reasons that we wanted to try this and pilot the Ride for Free program is that the state is changing their formula next year in FY26 to go by the ridership. We did this as an incentive to increase the ridership so that when it comes time to offer how much money each jurisdiction in the state of Maryland will get, then we would have a larger ridership offering us more funding. So currently we don't have plans to change it. It's working well. We have not lost a tremendous amount of revenue. It balances itself out because when you're dealing with cash revenue on a bus, it costs a lot of other things in the devil's in the details through accounting purposes. So we're going year by year and keeping our fingers crossed. How about that?
Thank you. Well, there is time left for us to have people come and ask questions. I have the name of one person who's signed up for it. Everyone will get 2 minutes to ask your question. If you can't get it done in 2 minutes, we'll probably cut you off. But so please find somebody with a microphone. But Bryce Alexander is the first person who actually signed up, and then someone will find you with your hand up.
Hi, how are you? I have two, actually. One, I guess, is for community services. Would you expand on that thing about the Medicare Part D from the state retirees that is being changed or something? My wife is a state retiree, and I'm interested in knowing what you were talking about there. I kind of missed it. So.
Right. What I would tell you, my best advice, raise your hand, Jennifer. Jennifer is here. She's one of my program specialists. She does benefits counseling for anyone over the age of 55 for the county for your benefits. But she's been working with the state and learning information about that. So she has information on her table out in the hallway and has been talking to the Department of Budget and Management about these changes that are coming. So she has a much deeper knowledge and expertise. And it's individual for each of you, especially if you're a couple and you're both on the plan. You know, you might need one prescription plan for you and a different one for your wife. But the plans are, there's a lot of resources, and Jennifer can link you to each of them.
Okay.
So I would highly recommend that.
Okay, thank you. Second question, I guess, would be for health services. I'm in a position where I have an older sister-in-law who's probably going to wind up living with us very shortly. And, well, there might be a little more to this. One would be I might need to renovate an area for her to live in. Secondly, I might need to have some in-home caregivers. Now, I know there's a young woman here who gave me some information about her services or whatever. But are there any services for in-home caregiving that are not going to cost me an arm and a leg, basically? She was in a previous facility, and it was $6,000 a month for her to, and it was just we can't afford that, you know. So
We have a program in conjunction with Emergency Services and the Health Department. It's called our Mobile Integrated Community Health Program. What I would recommend is that you give the Health Department a call and talk to the nurse in charge of Mobile Integrated Health. They can set up a time and an appointment in which a community nurse as well as a EMS paramedic will come in and do a home safety check, specifically addressing the issues of falls and potential needs, soft floors, wires, O2 tubing, all of the trip hazards that are in a home. And we can also get her an AIRS evaluation and see what can be provided for her. But that's where you start the process, okay?
Regarding lane closures, you mentioned 1 and 2 o'clock as one of the time periods that they close, but I've noticed that at 10 o'clock on a daily basis, the lanes are closed going westbound. Do you have a schedule, or better yet, is there a way of our residents reaching out on a daily basis to find out what lanes are closing and when?
10 till 10 a.m. till 8 p.m. is Saturdays and Sundays, but we are done closing for the season. So that won't come back until next year, and it might be tweaked then, but the year we're just ending, the summer season we're just ending, that was from 10 a.m. to 8 p.m., the closures, westbound, on the Route 8 ramp and the Duke Street ramp also.
Another way to find out some of the live closures, in addition to what the commissioner said, was if you call the 877 BASEPAN, BAYSPAN, that gives you live time traffic updates as well as what the count is for the backup. And it'll say that there are currently 3 lanes flowing eastbound and 2 lanes flowing westbound, which will help out. So it's 1877 BAY, BAYSPAN, and we use that for our guys and girls too as well. It gives us live time traffic stuff.
I noticed one thing. I can talk really loud. This is not just going to end because summer's over. We're getting this now through the whole winter. I mean, traffic can be blocked up going westbound every day. And you schedule your times, but that's not saying people not listening at the times, because you're seeing traffic going through. And then if we go on the westbound side, you're seeing the traffic coming eastbound. Really, you ought to put a easy pass on the westbound. That would cut some of it out, because a lot of people are coming down or coming from Ocean City that don't have an easy pass. They're going straight on over the bridge, but they're stopping the folks, the residents, from getting to where we have to go. And like I say, when you got emergency and you got 3 lanes going, and here comes emergency vehicles coming down on the right side, you got somebody that probably not going to see them or not going to hear a siren and pull out, then there's another accident that's going to happen. So we really need to look at that. I know closing up where I live, or where we live, just about the last overpass before the bridge. People now are coming through Stevensville, coming around, and they can't get over. People are coming down to the Kent Narrows Bridge and going around like you're going to Harris's or like you're going to Red Eye Dock Bar, but what they're doing, they're keeping straight on up and coming out the other side and getting into the traffic. Well, here I am down at the end of the beginning of the bridge, and I'm looking at them, see them coming out 5 or 6 at a time. That's gonna come all the way around. When they get down by the Kent Narrows, by the shopping center, where Hardee's is, they're going in on that side, coming out through that, and coming out in front of traffic. It's something that really needs to be looked at.
Well, it is looked at, but, you know, again, the state will only allow us to do so much. They only allow us to close so much. And then you got to take into consideration all of the businesses in that corridor. You know, you start closing all those ramps. You know, with Kent Narrows, we'd like to close one of the westbound ramps. The second one would be the ideal one to close, to force everyone to go in the first one, and then they get caught up in the Kent Narrows drawbridge, and that deters them from going that way. So, but you have to consider the businesses, and that's why the state's taking it in sections, in chunks, and see what we can do moving forward for next year. Yep.
I'd like to address everybody at the table, especially the sheriff and law enforcement. And Sheriff, you should know about this since your office records the calls I make to you, right? But this idea that the 325,000 children who went missing in this country are because American men like to have sex with children, are you people crazy? Yeah, it does. Because that's a lie. Our American men are not doing that. The sheriff and the police all know who those people are who have that problem. That's a cover story because these children are being organ harvested. They're sending them here into this country for organ harvesting, and anybody who sees doctor's offices or surgical suites through the night needs to call the police, because that's a crime. They're sending their children from around the world, these governments, because our kids they don't like the fact that we have chemicals in our food, so they don't consider American kids to have healthy organs. So they send them from outside the country, and they're killing them, and then they're cremating them. So you think about that, and next time you want to believe some lie from another country that American men are a bunch of perverts, you look at your families, your husbands, dead or alive, your children, your sons, and you ask yourself if that's true. Thank you.
Like several years ago, and it needs painting bad.
Okay. Are you at Graceville Terrace?
Graceville Terrace.
Yeah. I've noted, that was one of the first things I noticed, that those areas do need to have a lot of paint, but if yours was sanded, if you can give a call, again, which apartment is yours? Which apartment is yours?
My apartment's 3.
3? Okay.
My name's Linda Brady. I'm from Terrapin Grove. I have a couple comments. First of all, I want to thank the Commission on Aging for presenting this and sponsoring this town hall meeting. I was at last year's, and I think those who are here this year that were here last year as well will notice 2 significant things. The panel members were fabulous last year, -1. And the panel members this year are absolutely fabulous. And thanks to Steve Wilson, the commissioners, Todd Mon, and Mike Clark. Thank you so much. And I hope you continue this.
Hey everybody, I'm Doug Bishop from the Bay Times Record Observer newspaper. I've had the privilege of covering our county for the last 25 years, and I just wanted to point out, as this fine lady just did, I've known most of these folks, including Janet, for many, many years, and I can tell you that there's nobody that could represent us better and our interests than these folks right here. They have a passion for what they do and a drive for excellence. And I just wanted to thank them very much for what they do for all of us. And thank you. I wanted to add something to what Gary said. Our state's attorney, Lance Richardson, told me that 80% of the people who get prosecuted in our county don't live here. So what does that say about the people that do live here? We have one of the best counties in all of the United States. Now, we're not perfect. We've got challenges like with the traffic and everything, and people are trying to do something about it. It's not like they're ignoring it. And Kathy, whoever said that thing about the lunches, they're dead wrong.
Thank you.
And I want to tell you that my head snapped when I heard that, because everybody that I eat lunch with at the YMCA, at the Active Aging Center, would totally disagree with that. And I don't know if you all know about this, but they only asked for a donation of $3 to feed you a wonderful lunch. I'm amazed at it, and thanks for providing that.
Thank you.
Hi, I want to give a shout out to the panel. I know you, Mr. Hoffman.
How you doing?
And Mr. Clark, I met you. I want to give you a shout out. I was on the waiting list for a year. That man said, put me in my apartment. I like it out here. Yeah. But only thing, when you were talking about the crime, put ID badges on the maintenance people. I don't know who they are. You know, I moved here from the city. I don't know their name. I don't know. It's unrecognizable to me. They come to your apartment. I don't know who they are. For safety.
Good suggestion.
You understand? And what about the weekends? We don't have nothing to do out here. All right, thanks.
Thank you. Housing, we do have one thing, you're right about the ID badges, and we can do that. That'd be relatively easy to do because they have IDs, and we can do that. But we've also just recently gotten uniforms for our maintenance folks, so. Good suggestion.
Any other questions for our panel? There's plenty to do at the library on the weekend, so I know y'all can come there, but
Sir, they're going to be asking you to do the yoga classes, okay?
well, I do want to thank our panel for being here today and being such great sports for coming, and thank you all for showing up and asking such great questions. We do still have refreshments. Please take some time and talk amongst yourselves. Thank you so much.